The goals of management of diabetes include controlling the blood sugars, reducing complications associated with type 2 diabetes, improving the quality of life, reducing overdependence on drugs and medication, reducing fatality and deaths due to diabetes. My name is Lilian Mumina. I am a clinical nutritionist, and I am going to take us through a session of understanding diet as a control and preventive mechanism of type 2 diabetes. Stick around until the end because I'll be giving us tips here and there on the types of foods that you're supposed to be taking in so that you control your blood sugars. Without further ado, let's get into it. First things first, you need to understand the glycemic index of food. This is basically how fast or how slow a food raises the blood glucose. So when you take up a certain food, it is going to affect your blood glucose. It will either raise it or help you control it. Understanding glycemic index is very important in diabetes patients because it will help us in the controlling of the blood sugars. What are some of the things that affect the glycemic index of food? The basic one is the type of food that you're going to select. We all understand that carbohydrates is the main nutrient that spikes up glucose. Anything that you consume that the end product of digestion is glucose or the simple sugars is going to affect your blood glucose by raising it up. In your food selections, you need to take carbohydrate sources that are lower in terms of glycemic index. Basically, the whole grain carbohydrates, the brown chapatis, the brown rice, the brown ugali. Their glycemic index is lower compared to their processed and refined carbohydrates because they're going to take more time in digestion. The glucose spike will come in slowly. On consumption, you don't spike the blood glucose instantly. The whole grain carbohydrates come with fiber and other micronutrients that help support the metabolic system, and this will help better control of the blood glucose. The second thing on glycemic index is the combination. What are you taking with that carbohydrate? Are you adding some fat in it? Are you adding some protein in it? Are you adding some other micronutrients? This is because adding some nutrients such as fat to maybe your carbohydrate source will not only reduce the quantities of carbohydrates that you're going to eat, but it will directly affect the glycemic index of that carbohydrate. A perfect example is combining something like rice and fish as opposed to something like rice and beans. These two meals, they are rich in all the other macronutrients. The fat content is higher in rice and fish than rice and beans. You will get that the blood glucose spikes of these meals compared, the one with rice and beans will be higher than the ones with rice and fish. What you can do if you are diabetic is add an avocado to the rice and beans, or the rice and lentils, rice and jahe, so that you can have an extra amount of fat. Also, something like adding a glass of milk in your meals, because milk has a good percentage of fat, it will help you lower the glycemic index of food. Remember that milk has glucose and galactose. So do not overconsume milk because it will again bring the negative effect of raising the blood sugar. The third thing that affects glycemic index of a particular food is how you're going to prepare it. If you are diabetic, it is advisable to avoid certain additives when you're preparing your meals. There are specific additives that you can add to a food, and this will increase its glycemic index. Any additives that has some sugar, it has some fructose, additional carbohydrate, let's say breadcrumbs. When you're baking your chicken and you're going to coat it, you're going to add some syrups here and there for taste and such things, you are altering the glycemic index of that chicken. You need to prepare meals in their most natural state, and if it's additives that you add in, you can add something like butter, ghee. It will add some fat content in the food and reduce the glycemic index, but don't overdo it. The other thing that you need to consider, of course, is the frequency of feeds. Over consuming carbohydrates during the day, it will increase the number of times that your blood glucose is going to be spiked up. Apart from amount of carbohydrates, you need to control the number of times that you're going to eat this food. Overconsumption of protein also leads to elevated blood glucose. Limit your meal times to at least 3 meals. So make sure that your meals are well combined. Include a fat source, do nuts, do avocados. You can always do fish or mena. You can always do a cod liver oil supplement here and there. You can always add an MCT oil or maybe something like olive oil or coconut oil. This will help in the long run in reducing over dependence on drugs. So sit with a dietitian, have them plan for you a meal plan that is geared and it is individualized to your specific nutrient needs because of different activity levels, different genes, how we metabolize our meals, the functionality of the gut system. Diabetes also affects how our GIT functions. Maybe you're having things like maybe diarrhea, you're vomiting here and there, constipation, and all this affects your nutrient utilization and nutrient uptake. Another thing on diet is control protein. Protein is an essential macronutrient, and overconsumption of protein is very common in diabetic patients because they are trying to overcompensate because of reducing carbohydrates. Diabetes is one of of the leading causes of kidney failures. The end products of protein is usually urea. The kidneys are going to be overworked. They release uric acids, and this affects your joint health. They will bring about so many complications, and your metabolic system is already compromised. There's a lot of cell death and cell damage and injuries with diabetes patients. We need the protein for repair of all this, but we don't need too much protein. An intake of roughly 0.8 to 1.2 grams per kg body weight a day is more than enough for someone who's diabetic. If you are active, if you're doing sports, if you're doing vigorous exercise, you can go up to 1.5 maybe to 2. Protein needs are different because of body size, activity, because of disease severity. When you overconsume protein, they will eventually be converted to glucose, and then it will increase the blood glucose, increase your fat intake. Fat lowers the glycemic index of any particular food. So if you're taking nuts and you do bread and peanut butter, it will help you lower the glycemic index of that bread. If you add something like peanut butter or matoke, it will help you lower the glycemic index of that specific meal. Fat is very important in diabetes management. Apart from the concerns that people have on diabetic ketoacidosis, which if well planned will not be a problem at all, because we are still on medication, so we're not going to jump into the high fat kind of diet. You're going to slowly grow into it. The easiest way to grow into a low carb, high fat kind of diet is to do it gradually. Another thing on management, take care of our fluid needs, our water intake, our hydration levels. Dehydration is a very serious problem with diabetes patients because you're frequently urinating, you're losing water, you're losing fluids. So replacing that fluid is very important in maintaining the fluid balance, the normal metabolic activities. Also preventing cellular dehydration, which can lead to shock because of loss of electrolytes. Also make sure that you take care of your electrolytes, the sodium, the potassium, and such. You're losing urine, the urine comes out with electrolytes. Take care of that. Take up a banana. Increase intake of foods that are rich in potassium, things like avocados, things like the spinach, green leafy vegetables, all that. Fruits, they are a very good source of potassium. If your diet is limited, you can always do electrolyte sips. On sodium, we don't want to take so much because the body needs a very small amount of sodium. People with diabetes have a 80% chance of developing hypertension. Moderate intake, you should not go beyond 2300 milligrams a day. You need the sodium, yes, because of the balance of sodium and potassium, but you don't need too much of it. In fact, let's purpose on doing potassium. And managing diabetes entails a holistic approach. Make sure that you protect and manage your mental health, reduce and manage the stressful conditions, try and sleep well, because again, diabetes usually have a lot of sleep apnea, sleep losses, insomnia. Engage in physical activities, share, talk to a person, go to clinics. In the clinic, there is support groups. We also want you to control your alcohol and smoking because they are bad for you, they are bad for your health, and they are bad for diabetes. Let's work towards all that. Tell me in the comment section down below what you're struggling with, what you'd like us to address in relation to diabetes. We'll be more than glad to do that. Give this video a thumbs up if you've not done so, and see you next.